Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our lecture is glaucoma. So glaucoma is basically characterized by a condition in which there is an increased intraocular pressure in the vitreous chamber. So that is basically the main clinical presentation by which it is signified that it is a glaucomatous condition, and it can prove quite serious for the patient, as it can result in a permanent vision loss of the patient. So usually glaucoma is found to be congenital, but it is only displayed later in the life, usually in the third or the fourth decade of life, due to the fact that the initial clinical presentations are usually the loss of the peripheral vision that is not basically noticed by the patient. So until it is progressive disease and basically it manifests as a complete vision loss in the person, so until and unless it hinders the visual acuity to the level that the patient has problems, and he presents to the clinician with the complaints of the vision loss in a single eye, that is unilaterally or sometimes bilaterally. So we'll be discussing this condition over here in this lecture. In the first section, we'll be discussing the definition of this condition. So what are the prime characteristics of this condition by which we can define this clinical presentation? What are the parameters for it? We'll be discussing them over here in this very first section. And then we'll be moving on to the affected parts of the eye. So if there is an increased intraocular pressure, how it can affect the structures of the eye, and what are the damages that it can cause or result into, which are going to subsequently result in a permanent vision loss of the patient. So we'll be discussing that over here, and then the different types of this glaucomatous condition. As I've already emphasized, usually it's a congenital condition. But sometimes it occurs later in life. So what are the conditions? It can be an infectious state. It can be a traumatizing state. So what are the various factors that contribute towards the development of this glaucomatous condition? We'll be discussing that over here in this very first section. Moving on, in the second section, we'll be discussing the glaucoma diagnosis. So again, it's very important to discuss the parameters on the basis of which we're going to diagnose this condition. The parameters will be discussed over here, and then we'll move on to the different stages of this disease, obviously starting from the early signs and symptoms and then moving on to the advanced stages of this phenomena or this pathological condition. Then we'll be discussing the treatment or the treatment modalities, ranging broadly into, first of all, the medical treatments, the drugs that are involved in the treatment of glaucoma, and then we'll move on to discuss the surgical treatments or the surgical modalities that are present out there to treat this condition in which there is an increased intraocular pressure, obviously. The surgeries would depend upon the causative factors. So discussing the causative factors and then laying a bound towards that causative factors is the mainstay of the surgeries over here. And when do we go for this surgery? When is it an emergency state to treat this condition in a surgical way? That will be discussed over here. In the third and the final section, we'll be discussing the acute angle closure glaucoma. Mainly, we'll be discussing this kind of glaucoma in detail because it's an emergency condition and it can result in a complete loss of vision in the affected eye. So it's again very important to know the diagnosis, the clinical features, the clinical presentations, and finally, how to deal with this condition, which is known as an acute angle closure glaucoma. The clinical features, and then we'll mainly broadly divide the treatment modalities into the medical and as well as the surgical management of the patient. So I hope you want to learn more about glaucoma. So do watch the other sections to this lecture as well.